And as we continue to deal with COVID-19, there's also another health concern around the corner. In addition to the upcoming flu season, fall is when doctors see more cases of a condition called acute flaccid myelitis. And the CDC says more people are expected to get that this year. We're joined by New Hampshire State epidemiologist Dr. Benjamin Chan. Dr. Chan, first let's touch base on coronavirus. We're still seeing less than 1% positivity rate. So what does that tell us about the situation here in New Hampshire?
You're right. We're seeing low but stable transmission of COVID-19 within our communities here in New Hampshire. So it hasn't gone away. The risk is still out there, and we still need people to follow the public health recommendations around social distancing, cloth face mask use, frequent hand hygiene, and certainly if someone is ill or having symptoms, they should stay home and not go out in public settings. These steps will protect not only against COVID-19, but many other types of infections and respiratory viruses that can and will be circulating in the next several months.
Okay, and with that, what is acute flaccid myelitis and what causes it?
Yeah, so acute flaccid myelitis, or AFM, is an uncommon but severe neurologic condition that causes muscle weakness and ultimately can lead to paralysis. This has been referred to in the past as a polio-like syndrome, but poliovirus has not been found in these individuals, and poliovirus doesn't circulate within the United States. But this is a syndrome that has primarily been affecting children in past years, particularly during the months of August through November. And presents usually with sudden onset of arm or leg weakness, loss of muscle tone, and a majority of children that have this report a fever or respiratory viral-like illness in the 1 to 2 weeks before onset of the weakness. So we believe that this is likely caused by a number of different viruses, primary among them being a virus called enterovirus D68. Now, if people remember, we began seeing increases in AFM back in 2014, and that coincided with a national outbreak of severe respiratory infections related to this enterovirus type D68. And so we expect potential increases again this year.
Okay, Dr. Chan, so what should parents do to protect their children and families?
So the same steps that we recommend to protect against COVID can protect and will protect against spread of many other different types of viruses and respiratory infections, some of which may contribute to acute flaccid myelitis. And just to be clear, we don't believe COVID-19 causes AFM, but there are other viruses like this enterovirus D68, which can lead to or cause acute flaccid myelitis. And so it remains important for people to continue with the social distancing, the cloth face mask use, practicing frequent hand hygiene, staying home when someone is ill, because these steps, again, will protect against a variety of different infections, including influenza and enteroviral infections. The important thing to know about AFM, though, is that if a parent or guardian is concerned their children might have this, they should seek medical care immediately, because kids with AFM really need to be hospitalized for close neurologic monitoring and testing, because AFM can also affect a person's ability to breathe. So we want parents, guardians, providers to be on the lookout. We believe this is not a common condition, but the CDC is predicting a possible increase this year because we've seen increases on this 2-year cycle since 2014.
All right, Dr. Chan, thank you as always for your time.
My pleasure. Thank you.